Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Johns Hopkins virologist Andy Pekosh about the other vaccine, the influenza vaccine. They discuss what to expect from this year's flu season after COVID-19 virtually wiped out last year's, and why it's more important than ever to get a flu shot. Let's listen.
Andy Pekosh, thanks so much for joining me.
Oh, it's a pleasure to be here as always.
So, Andy, let's talk about the flu. So I got my flu shot. I know you got your flu shot. There was almost no flu last year. So will we see flu this year?
Yeah, so there's a good chance that we will see flu this year. And I say that because last year we didn't see flu, but we also didn't see a number of other respiratory viruses. We didn't see rhinoviruses that cause the common cold. We didn't see RSV, which is a virus that infects kids and can cause some rather severe respiratory illness. And we didn't see flu. We also had more public health interventions in place last year. Now, we don't have as many strict public health interventions as we did last year. And we have seen a real big surge in rhinovirus cases and common colds. We have seen surges in RSV. And so the next thing we expect to see is flu, because that's the way they normally follow each other in a regular respiratory season.
So what you're saying is one of the reasons that we didn't see a lot of flu last year is because we were all masked up, washing our hands like crazy, not getting really close to other people.
Absolutely. And I think what also helped us when it comes to keeping down things like flu and other diseases we usually see is we had a higher level of immunity in the population. So what that means is there were less of us in any year. There's less of us that are susceptible to flu than there were that were susceptible to COVID-19. And so public health interventions plus this immunity in the population helped us keep down the cases of flu and RSV. Now we're relieving that public health intervention and we're relying more on the immunity to flu that we have in the population. So now we expect to see some cases of flu, particularly if we don't get a lot of people getting their influenza vaccine.
Mm-hmm. That makes you nervous.
Yeah, because, pre-COVID, I was spending all my time working on influenza, and influenza does cause a significant amount of disease in the population. It pales with respect to what happened with COVID-19, but it is dangerous, and it's particularly dangerous to the young and the elderly in the human population. And so a resurgence of flu on top of dealing with COVID-19 levels represents, two really significant challenges to us in terms of the people working on respiratory viruses.
How does COVID complicate things?
Well, one good example is the CDC's, the Centers for Disease Control. They monitor something called influenza-like illness. And that's people who report in a certain set of symptoms that are rather nonspecific. Coughs, colds, fevers, sneezing, those kind of things. Initially, when COVID-19 appeared, this ILI indicator went through the roof. Not because we had lots of influenza, but because people were reporting COVID-19 symptoms and those were being classified as influenza symptoms. And I worry now we're going to see the same sort of level of confusion. For about a year now, if people had a cough or felt respiratory symptoms, it was pretty clear that they were probably going to have COVID-19. But now we have all these other respiratory viruses around. So diagnosing what you're infected with. Are you infected with COVID or are you just infected with something that's giving you symptoms that you may be confusing with COVID is going to be an important thing going forward.
And it's important to know what you have.
Absolutely. The course of treatment is completely dependent upon what you have. And that has to then get back to how do you know what you have? Get back to testing. And you have to be tested with an accurate test to know what you're infected with.
Now, the gut reaction, for example, some of my son's friends at school had pretty bad colds and their mothers took them to get COVID tests and they were negative. So that's probably the end of it, right? But what if they have the flu and they're just happy they don't have COVID and they're trying to just move on with their lives? it feels as though there's a missing link here because we don't give COVID tests at the same places we give flu tests.
Yeah. And I would argue if you're positive for the flu, you should stay home just as you would stay home if you were COVID-19 positive, because you could spread that to other people and cause a significant amount of disease, particularly in younger populations. And now that we're talking about kids going back to school in person full time, we have to think about flu as being a significant pathogen that can cause kids to get very sick. And every year kids die from influenza. So just because you have respiratory symptoms and you're COVID-19 negative doesn't mean that you should be happy and excited. I'm very glad that you don't have COVID-19, but you could have something like influenza, which could be just as dangerous to particularly younger populations.
So we don't know. Every year, the virology community gets together and tries to decide which strains of the flu to protect against in the vaccine. And I'm wondering how you were able to make those calculations this year, given that there was almost no flu anywhere last year.
Yeah, the meetings were very different this year. Much fewer choices among strains. Interestingly, there is some data out there that a couple of strains of flu may have died out because we haven't detected them in 6 to 9 months. So again, it's interesting that these public health interventions have really potentially decimated some strains of flu and made them just non-existent anymore. But there have been a few strains of flu detected in other parts of the country and in other parts of the world, and vaccines have been made based on those guesses. So what we really are going to be looking for, particularly in the next month or so October, November, is what are those first few strains in the US look like? Do they match the vaccine? And are they A or B influenza? Because B is the one that we're a little bit more concerned about, because that's the one that circulates in kids to a little bit higher extent. And that's where we think that the greatest lack of immunity will be to influenza.
Is there any sense that this could have really damaged flu and we won't see as much?
Always a possibility. We don't know much about the strains that have survived all of the lockdowns. And it may be that some of them are a little bit weaker too. That would, I think, be the best case scenario, is that the strains that are emerging from this pandemic are not really the best ones to infect humans. But it's a big question mark right now. We know changes have happened with the flu strains that have circulated. We just don't know the true impact that they're going to have on influenza cases this year.
Quick question. Can I get a flu shot at the same time as a booster shot?
Absolutely. CDC guidelines says that you can get both at the same time. There should be no issues whatsoever in terms of your reaction to that, to either shot.
Terrific. We're seeing some misinformation out there that I was hoping you could help us with. So I've seen something that says the flu shot is protective against COVID. I've seen that COVID tests pick up the flu virus. These aren't true, are they?
No, the virus that causes COVID and the viruses that cause influenza are very, very different on so many different levels. The tests for COVID-19 don't pick up flu and vice versa. The flu vaccine protects against flu strains, doesn't protect against COVID-19 and vice versa. So they may cause symptoms that, like I said, may at least initially seem like they're the same thing, but the viruses that cause them, the vaccines that protect against them, and the tests that detect them are very, very different and don't cross-react.
If we've seen anything this year, it's an incredible rise in anti-vax rhetoric, right? People who say don't get vaccines, especially against COVID. I know that I'm worried that all this anti-vax rhetoric could be contributing to fewer people getting the flu shot. I'm wondering if you think that might be the case.
Yeah, I do worry about the same thing, particularly because, the COVID-19 vaccines, for all the discussion, even nowadays, about booster shots and waning immunity, all the data shows that the COVID-19 vaccines are performing really, really well, particularly against severe disease. The COVID-19 vaccine data that we've seen in the past year is much better than what we usually see with influenza. And we know that our influenza vaccines, while they're not as good as the COVID-19 vaccines, still save a lot of lives every year. And I worry that, if we're seeing such hesitancy with a really, really good vaccine like the COVID-19 vaccine, that's just going to spill over and be even more of a problem when it comes to the influenza vaccine, which is, again, good, but not as effective as the COVID-19 vaccines are against them.
So what do we do right now? I guess go get your shot?
now is the perfect time to get your influenza shot. If we expect a strong flu season, it'll be an early flu season. So now is a great time to get it to make sure that if the viruses come early, we'll get a good amount of protection in the population. And, for those of you eligible for a COVID-19 booster, get your flu shot when you get your COVID-19 booster. You can take them both together. Both will be really important in terms of keeping down cases, and both are going to be very important in terms of how we deal with the upcoming respiratory virus season.
Yeah. And what else are you looking for in the coming season?
Well, the biggest thing, with influenza, we have the elderly as a population that are very sensitive to severe disease, but we also have children that are susceptible to severe disease. And with COVID-19, that has spared kids from too much severe disease, but influenza may bring that risk back. So I think we're paying particular attention to kids in school, trying to see what respiratory viruses are circulating there, riding on top of the COVID-19 surveillance efforts, because we know historically that schools are a fantastically efficient place at spreading influenza. And so I think if we're going to see a signal from influenza, it'll be in the kids that are going back to school this year.
I would think, though, in places where masks are required, wouldn't that mean that we wouldn't have spread of either, or the kids just not as careful as we wish they were?
I always view each of these as layered levels of protection. And so in your ideal situation, if you're vaccinated, wearing a mask, and keeping that 6-foot distance from each other, you've got 3 layers of protection that make it very unlikely that you'll get infected. As you remove each of those layers, your risk increases. And in schools, this issue of keeping social distancing is a really, really challenging one to have. So we're going to lose that part of the protection. And so therefore, we would expect to see some increase in spread because of that.
And also, flu virus lives on surfaces for a relatively decent amount of time. Is that right?
Yeah, with influenza, perhaps more so than with SARS-CoV-2, the virus that causes COVID-19, you can pick it up from surfaces. Hand washing becomes a really important thing for influenza. It's been documented to work for influenza. The data on hand washing and COVID-19 is a little bit mixed because SARS-CoV-2 seems to really prefer the respiratory route for spread. So all these public health interventions need to stay in place because, like I said, we're probably going to see influenza now. And these are good, healthy, hygiene things to do for more than just COVID-19 reasons.
Andy Pekosh, thanks so much for joining me.
Thank you very much again.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.